I would like to thank Sir again for this wonderful book, Radiology Without Tears, only and only because of which I could pass DNB in first attempt after MD back in 2020. So, and you are all still more lucky that you have this entire website itself, that is Radiology Without Tears. Okay, so with this, let's begin with today's session. Sure success. Sure success in MD and DNB radiology. It's basically a 6-month strategy for theory examinations. So most of my session I'll be covering on theory preparation and examinations, and last couple of slides I'll be dealing with practical examinations also. So why do we want to plan? Because as Benjamin Franklin said, if you fail to plan, so that means you're planning to fail. So we don't want to fail, right? So we want to plan systematically and in an organized manner. Okay, so I want to have the opinion of you all. How much time does an examiner typically spend evaluating a paper? All of you please type in your answers in chat box. Is it 2 to 5 minutes, 15 to 30 minutes? Okay, Bathula Kausalya thinks that the examiner spends about 15 to 30 minutes. And rest others, most of you all think that an examiner spends about 2 to 5 minutes per paper. Yes, that's very right. So, given the duration that the examiner will be able to spend only some 2 to 5 minutes, hardly 2 to 5 minutes per paper. So, in those 5 minutes, so our agenda, our goal should be to present ourselves, our knowledge, our presenting skills. So everything we should be able to present it only in 5 minutes so that the examiner will come to know that we have read, we have revised, we know the knowledge, and he'll be able to give us more marks. Right? So that is our goal. And why most residents fail despite studying? There are few points which we should take care of. We know the syllabus. Syllabus is same for everyone, right? But still we somehow fail to execute it. And we read, we divide all the syllabus into all 6 months, like CNS first month, CBS second month, physics third month. So we read it, we do read it, but we read it only once and we fail to revise. So inefficient revision also leads to failure. Now we have read, suppose we have read and revised, but we fail to integrate. We know imaging as a separate entity. We know pathology as a separate entity. But when it comes to integration, we are failing. So that is also one more point we should keep in mind. And also, obviously, exam condition is not like our normal library classroom condition, right? Library or classroom condition. It's entirely different. We have time limit. We have examiners looking at us, observing us. So it's a completely different environment. So all these factors, if not managed or prepared properly, might lead to failure. So basically, what does the exam test? It does not test only our knowledge, it also tests how clear we are about the concept and how, in a structured and in an organized manner, we are able to present ourselves, is also tested during exams. What there are certain differences between MD and DNB. In MD, we'll be getting little more time compared to DNB. So, and also longer answers are required. But we should also maintain the narrative flow, just not writing long answers. That flow also should be maintained for MD examination. Whereas for DNB, we don't have much time. We have strict time constraints. We have only 15 minutes for the long answer, for example. And here, structure and completeness is critical. And also because we have time constraint, we should write fast. So basically, the knowledge base is same, but the way we present is different in both MD and DNB exams. Coming to the timings, as I told you already, for DNB, it's only 15 minutes per long answer, whereas for MD, it's 30 minutes per long answer. So, irrespective of the timing, we should stick on to these headings while writing the answers. What are the headings? So, whatever the topic they might ask, like for example, they're asking about tuberculosis. So, how we should begin? We should begin with the definition, and then we have to go for classification, then imaging findings, then differential diagnosis, then complications. So, this sequence, these headings, we should keep in mind. Okay, now I have given a rough idea about how different are DNB and MD exams. Now we have to start reading, right? Okay. How do we start reading? We have to start finishing system wise. Like we have taken up CNS, we should finish CNS first and then go to the other system, that is like CVS, GIT, chest imaging, like that. So, by the term system, what I mean is, like if it is obstetrics and gynecology, you should finish it completely. Like you should finish women's imaging, prenatal diagnostics. Likewise, if you take up head and neck, you should finish ENT and maxillofacial imaging. For MSK, bone, joint, soft tissue imaging. So, likewise, if you take a system, you should finish it completely. Okay. Okay. Next. There are few non-system subjects also, like physics, radiological procedures, interventional radiology, and recent advances. These are actually the topics which a smart and a topper student revises very well because these are high yield topics. But most of us, we tend to neglect these topics, right? So that is where we fail. So these are the topics we should give much more importance because these are high yield topics and we should not underestimate these areas. Okay, now we have started reading. Just reading is enough? No, because what are we going to read in the exams? No, we are not going to read in the exams, right? What we are going to do in the exams is we are writing. Like, take an example of a runner. If he wants to run on the day of the competition, he has to practice running daily, right? If he thinks that no, I'll go to ground, I'll just sit and watch people running every day and only on the day of competition I'll run. No, is that possible? It is not possible, right? The same way, so if you're going to write in the exams, we should start writing from day one. So daily answer writing is the most important habit for any MD or DNB student to get success in the exam. If you start writing daily, everything else comes into place automatically. Okay, now I want to know your opinion. What is the most important part of the answer? Is it description, evaluation, conclusion, or analysis? What do you all think? Opinions might differ. Just I want to share my opinion, and I before that I want to know all of your opinions. What do you think? Okay, Riddhi feels that conclusion is important. Karthik feels that analysis is important. Okay, Akshit feels that evaluation is important. Is there anyone for A? Yes, Dr. Sakshi feels that description is important. Yes, Sakshi, I agree with you. See, description is the most important part of the answer. I'll tell you why in the later part. And if you want to master this skill of description, you have to start writing the answers daily. It is a non-negotiable habit. I can't stress much enough, but daily writing the answers daily is a very important habit that you have to start. You have to cultivate. Please don't neglect, right? I know in residency you'll be very busy with the works, but still make time for writing the answers daily. So, how you should divide the time duration? Like you have 6 months for the exams, right? So, let us divide those 6 months into three equal parts. So, first 2 months, you have to write one answer daily. That's enough. But what you should focus on while writing the answers? First 2 months, we are not focusing on how fast you write. So, our main focus is on the structure. How, in a structured way, you are able to write the answer. So, that is the focus for the first 2 months. So now you have mastered the structured way of presenting your answers. Now is the time after like 2 months. Next 2 months is for the timing. Next, that is third and fourth month, you have to start writing the answers, maintaining the timing. You take a timer, start it, and then start writing the answer, and then analyze whether uh, you have maintained the time or you have not maintained the time. Okay, that's about first 4 months. The last 2 months, you should start writing more answers, right? So, first 2 months, it's one answer daily. Next 2 months, 2 to 3 answers daily. And the last 2 months, you have to write at least 3 to 5 answers daily. And under what conditions? Under a simulated exam environment, it has to be. Like you have to take an exam style answer papers. You should keep away all your mobiles, distractions. You should take break only when needed and then start writing the answers in this way. Okay. So writing daily is very important. If you ask me, ma'am, I have like half an hour a day and I am confused whether to spend that half an hour to read extra pages or to write the answer. I would say you better write answers because reading more is not important in the exam. How well you can present yourself in exam is more important. Okay, so coming to this 6 months macro plan, as I told you already, now let us organize it in a systematic way. Like first 1 to 2 months, what you are doing? You are doing foundation reading plus daily writing habit. Next 2 months, you would have read quite a bit of syllabus already. So you have to start integrating everything, like I told you, anatomy, physiology, clinical features, imaging, differentials. You have to start integrating everything in your answers, and also you have to focus on the time. Fifth month, exam oriented writing, simulating the exam environment itself. And also, revision also should begin hand in hand. And sixth month is for full practice papers, full mock exams, and fine tuning yourselves. So, like this, you have to think and do in cycles. It is not like for all 6 months you're reading, reading, reading. No, that is not how it works. You should think and you should work in cycles. Okay, just one time reading will not fetch you anything more. Okay, now we know that we should start writing daily and we should also read. What to read? From where to read? We all know that there are too many resources available today, right? Like textbooks, we have coaching notes, you have YouTube videos. Also, we have Radiology Without Tears website also. So, what it matters is you pick any one of this, but you make sure that you understand the topic and you retain the topic and you are able to present that topic in the exam. So that is important. From where you read is not so important, but how much you retain and how much you present is important. How much you reproduce in the exams is important. So you have started reading. Okay, you have picked Radiology Without Tears website for reading and you have started reading. What next? How do you go about it? You take a notes and start making notes. How do you make notes? Those notes should be in your own handwriting and also in your own words. It is not like copying as it is. Whatever the words are there in the notes, you are copying. No, it is not that way. You should interpret and you should have your own words in your notes, that too in your own handwriting, because your own handwriting improves recall during the exams. And also, while writing the notes, you should not write more than a page for one topic, maximum one page per topic, and also under these headings. Like I have been stressing on these headings from the beginning: definition, etiology, imaging, differentials, and complications. You should make notes only strictly under these headings only. So, in your own words, in your own handwriting, and under these headings, one page per topic. Okay. What about the coaching notes? Ma'am, already there are so many coaching notes. Why are you making us make the notes again? Because, yeah, 100% coaching notes are useful. No doubt in that. But when you make your own notes, if you see anything extras from somewhere, like any coaching notes, you see some extra points, you can start adding those extra points to your own notes. That's how you modify, you expand, you personalize your notes. But make sure that you make your own notes. because these are the notes you are going to remember for a long time and more effectively than the printed notes. Okay, now you have read and you have first you have started writing daily, you have started reading, you have started making notes. Okay, now you want to revise. How do you want to revise? I'll tell you. So, first time you read a topic, right? So, second, you want to revise. That is the first revision. So, first revision obviously will not be able to recall 100% of what you have read. So, take the notes, close your eyes, and then start recalling whatever you know about that topic. Let's say you are able to recall only 50%. Okay, after your recall, just open your eyes and then read rest of the notes, whichever the points you are not able to recall. That is the first revision. So second revision, same thing. You have to take close your eyes, recall. So this time you'll be able to recall more, 100%. Definitely you'll be able to recall at least 10% more of what you had recalled before. Next, third revision, you'll be able to recall 80%. So that's how the revision should be active recall, because the forced retrieval will help our brain remember more effectively and for more longer time rather than just passive rereading. If you keep on opening the same notes and if you keep on reading passively 100 times also, it is not effective. So the revision also needs some skills. Okay, that's about revision. Now coming to social media, a big question. We all know that most residents and also even including me, we all use social media daily, right? And if I tell you all to completely quit from tomorrow, is it realistic? Is it possible? No, right? So we should think of some practical solutions. So how do we solve this problem? Basically, be aware, be mindful of what you are doing. It is not the denial which is going to benefit you. It is the awareness, it is the mindfulness which is going to bring excellence for you, right? Okay. So, how do we use social media? Just rather than passively scrolling, watching some random reels without any recall, no retention, no systematic, no way, that will make your time waste, right? So, instead of that, what you can do is you have to do intentional and focused content learning. First, you have to decide what you want to learn. Like concept, like line focus principle, you are not able to understand by reading from your notes or coaching notes from website, wherever it is. So what you have to do is you open social media, you type that line focus principle, and you watch only that short or that video so that that concept becomes clear to you. So this is called mindful watching or mindful usage utilization of social media. So it's basically the same platform, right? But the way you utilize it will give you a completely different outcome, a positive outcome, I can say. Same way, YouTube. We have YouTube channel, Radiology Without Tears, also we have channel. So open that channel and you type in whatever the concept you want and you start watching the shorts or videos so that the concepts will be reinforced, and also that will avoid endless and time wasting scrolling. Same way with Instagram also. You just follow only limited and high quality radiology accounts only rather than following anything and everything. There are few accounts which post case based posts, single concept explanations, and also there'll be annotated images. So apart from this, you can also start answering daily spotters and case of the day on Radiology Without Tears Telegram group also. So basically, one simple rule is social media is not to replace your notes, reading, writing habit. It can only supplement, it can only boost up your knowledge and retaining capacity rather than substituting. It cannot substitute at all, it can only supplement your learning and memorizing power. Okay, that's about social media. Okay, now we have read, we have written, and then we have made notes, and we have made the best use of social media in a productive way, in a mindful way. Now we have few previous year question papers. How do we use them? So what you should do is you should just go through the question papers automatically you'll come to know, you'll start identifying which are the high frequency topics. So analyze such pattern and map those questions into your notes. Again, your notes is the basis. Whatever you're doing from outside will ultimately go into your notes. Okay. And you cross reference like that. After that, if there are any questions for which the answers are not there in your notes, you start updating your notes accordingly. You start adding that notes, those points to your notes so that your notes will become more complete and more wholesome. Basically, these question papers, previous year question papers, tell you how examiners think, and you should also think like an examiner to prepare well for the exam. And we have a universal answer template for system-wise for system topic. Like you have to start with introduction, then you have to write etiology, risk factors, then relevant radiological anatomy, pathophysiology, then clinical features, classification, staging, imaging, complications, treatment, differential diagnosis, and recent advances. This is the universal template, and you have to modify this template according to the question asked. And again, in imaging section, you can still break down like what is the role of imaging for that particular condition. Like you can add these points, like it helps in initial assessment, it helps in evaluation of disease extent, it helps in detection of complications, image guided interventions, and monitoring and follow up. This will be actually this you can apply for any of the answers if you think. Then coming to the modalities, you should present it in a systematic way, like radiographic findings, ultrasound findings, CT, MRI findings, and then nuclear medicine. If you think in this way, no, even like obviously in exams, you will be facing few familiar questions and also few very unfamiliar questions also. This template helps you for familiar questions. If you follow this template, you won't be writing endlessly, right? You'll be very precise about your answers. And for the unfamiliar questions, it will lead you to some points which you can write for that question, even if you don't know anything about that question also. So basically, following the template will be helpful for both familiar as well as unfamiliar questions. That was for the system based questions, right? Well, like for CNS questions, CVS related questions, this template will help. What about for the non system concepts like physics based questions? For that also we have a template. Start with a definition or principle, then basic physics concept, followed by components and system description, followed by working principle like important formulae, factors affecting image quality, radiation dose safety, artifacts, clinical applications, advantages and limitations, recent advances. So if you put these headings, now automatically you'll start getting some points about that topic. So this is a template you have to remember for physics. Okay. Now we'll come to the time division. How are we distributing or how are we dividing the time? Like if we consider DNB, it's just 15 minutes. So we are given a question and we are given a 15 minutes time. So how are we dividing? First 2 minutes, we'll create a mental blueprint. Okay, that is a rough outline. And 10 minutes we'll spend for writing the content. And 3 minutes for diagrams, highlighting and underlining. So it's basically you should focus on the completeness and coverage, right? And not elegance. And for 30 minutes, for MD, it is 30 minutes. So 5 minutes for headings planning, 20 minutes for the content writing, and 5 minutes for diagram, flowchart, and highlighting or finishing touch. So, diagrams, few points about diagrams I want to stress upon is you make sure that you draw at least one diagram per long answer and you label it clearly and legibly. See, simple line diagrams are also fine. You need not be an artistic person to make a perfect diagram, right? There, your drawing skills are not being assessed. Your knowledge and the way of presentation is being assessed. So don't waste too much time on your artistic perfection. But make sure that you draw at least one diagram per answer. Okay. I want to discuss few common mistakes that you make while writing the answers. Like I told you before, you are faced with a question which about which you know everything, and you start writing everything about that topic, and you will start having less time for the other questions. It should not be like that. You should give equal time for both familiar and unfamiliar questions. And if you don't follow the template, you will start missing headings. For some questions, you don't write definition. For some questions, you miss etiology. For some questions, you don't write complications. Please don't do that, okay? You just follow the template so that you won't be missing any headings. And also, poor time management. You know a question and you write everything about it. You don't know a question and you don't attempt at all. That is not how it works. You should give equal time for all the questions. And you should end every single answer with a conclusion, because you want to take your examiner along with you. You should grab the attention of the examiner, right? So for that, you should give a proper ending for every single answers, because exams reward organized thinking and systematic presentation. Okay. Now, how do you practice full length paper writing? First, make a schedule. Start writing the answers for full length papers every weekend or at least fortnightly. So, how do you do that? Sit with one full question paper, write continuously for 3 hours, just like you do. How do you do in exams? And you should follow strict exam rules, like no phone access, and you should take breaks only when necessary. And also, you should use exam style answer sheets. The more similar environment it is while you are practicing, the less stressful it will be during the exams. And from this, you can measure how ready you are for the exam also. So how do you use mock papers? After you write the papers, what you should assess is how much time did I take per question? Did I miss any subparts in the flow chart or in the template? Did I write any incomplete answers or all my answers were complete? Did my hand start paining? Did I lose the speed halfway or could I cope up with the speed all through the exam 3 hours? So that's how you should be able to assess after writing the mock paper. Make a schedule, make a table like this, like date, like on week one. For on first week, I had written CNS answers. I had wrote 5 answers. I took 25 minutes average. The mistakes I did was I was not able to draw diagrams. So the next time, what I'll do is I'll start adding diagrams. Same way, you should start adding your progress in this progress chart or table, because accountability or tracking converts your effort into measurable improvement. So this is how you should assess, as I told you before. So after assessment, you should make a list of a few red flag topics. What are red flag topics? These are your weak areas. And this is a running list. This list is not permanent. And it is different for different persons, right? Like for some person, it is MRI physics concept, TNM staging, interventional indications, anatomy based questions. These are your weak areas. And I'll practice, I'll start writing, I'll start reading more, I'll start revising more on these topics. And once I am confident on this MRI physics concept, I'll delete it from this list. Then I'll get maybe I might get one more topic which is red flag, and I'll start adding that to this table. So that's how this list goes. Okay, so one more opinion I want. What is the most predictable part of a practical exam? What do you all think? Whether it is spotters, Hosky, table viva? Okay, Shraddha Noor thinks that it is table viva. I'm sorry. Okay, so most of you all think that it is table viva, which is the most predictable part of a practical exam. Yes, even I think, and it is a fact that table viva is the most predictable part of a practical exam. So let me spend some time on practical exam now. So basically, there is this 5D success formula for radiology practical exam success, which is very well demonstrated with the real cases in this Radiology Without Tears Volume 2 book. So, what does 5D mean? First D is detection. First, you should be able to detect the lesion. And how do you master this skill? By practicing spotters from Radio Focus, Exam Going Radiology Group by Dr. Sanjay Sir, and other resources like the Radiologist Eye. Okay, now you have detected the lesion. What is the next D? You should be able to describe it. This is what I told you before, that this is the most important part of the answer. You should be able to present it like an expert with confidence, covering all the aspects of description. Next comes the differentials. While considering differentials, you should have complete diagnostic range: congenital, traumatic, inflammatory, neoplastic, everything. But keep it relevant to that particular case. Next D is differentials. You should justify why you consider this differential as more likely than the second one. Considering the factors like age, gender, clinical profile, you should provide justification. After that comes the discussion, which is the most predictable part, because it is in your hand how you take the discussion, in what direction you want to take. So you should not be you should be able to perform very well in this discussion part, because that is predictable. So if you follow all these 5 Ds properly, then you will get the sixth D, that is distinction. So please don't forget to score in spotters, Hosky, and table viva. Okay, now we have read, we have practiced writing, we have revised, we know everything. On the day of exam, how our mindset should be. So we are there in exam hall not to impress anyone. So you should be able to focus only on clarity and not on brilliance. And you should be clear. You should have structured communication, because that is what which wins. And also you have to be organized. So organization always beats eloquence. So you should be calm while writing the exam. So these are the few numbers you have to remember. We have 6 months now, and daily we'll be writing 3 to 5 answers. And it is 15 minutes time limit for DNB and 30 minutes time limit for MD, long answer. So the important factors are writing notes, making notes, and revising. If you write, if you start practice writing and then making notes, you will have clear ideas. And if you have the practice of writing and revision, that will lead to fluent recall. And if you start making notes and you have proper revision, that will lead to retention. And all these 3 points put together will give you exam success. Okay, so it is the same syllabus for everyone, right? In UG also you might have noticed that there were few friends of yours who used to spend less time, but still they used to score more than you. Why? What made the difference? It is the different strategy, daily writing habit, smart revision, and the structured answers which make the difference. So final take home message is, you should prepare like an examiner and not a student. And even though it is the same syllabus, you should have a different and smart strategy. Making notes and revision and writing is equals to success. So if you put in all these efforts in a very systematic way, then the success is definite and the exams are predictable. So now you know all the systematic strategy. Start today, write daily, revise systematically, so that the success becomes predictable. Prepare like an examiner and not a student. Thank you, everyone.
Thank you so much, Dr. Manjushree, for a truly insightful and inspiring session. Your clarity,
Thank you.
practical approach, and exam oriented insights were extremely valuable, especially for our residents. The way you connected concepts with real world practice made the session both engaging and meaningful. On behalf of the entire team and all participants, we sincerely thank you for taking out time and sharing your experience with us. We truly look forward for many more academic sessions with you. Thank you once again, and thank you everyone for joining. Thank you so much.
Thanks a lot, ma'am.
Thank you.